Alright, what's going on, guys, and welcome back to another video. Today I'm gonna do I want to do like a little gynecology real cases discussion. Today let's discuss about one case. This is actually a real case, not made up. I've seen this patient with my own eyes, so it's real. Yeah, so I think it's a good idea for everybody who's interested in medicine. If you are interested in clinical thinking, in diagnosis and treatment of the patient in gynecology department. All right, so let's start. Let's go to the first slide. All right, so there's a patient with the menorrhagia, excessive menstrual bleeding. This is what we are going to talk about today. So excessive menstrual bleeding, as we know, medical term is menorrhagia. All right, so there's a patient comes up to the hospital. 34-year-old female patient comes to the outpatient department of our hospital on July 2nd, 2019 with a complaint of excessive bleeding. All right, she comes here with an excessive bleeding. She claims her present history is that she claims 6 years ago she was diagnosed with uterine fibroid 1 centimeter in diameter. All right, pay attention. She was already diagnosed with uterine fibroid, first of all. All right, first let's pay attention to the fact that she's 34 years old, which means she is still in the reproductive age. So we have to pay attention, what does this bleeding mean? All right, she's reproductive age, and she was already 6 years ago was diagnosed with a uterine fibroid 1 centimeter in diameter, but there was no any change in menstruation, like in duration or in the amount of menstruation. There was no any change, so she was set up for a follow-up. And 2 years ago, without any apparent reason, her menstrual bleedings was more than usual in quantity. So it means like for example, if her menstruation was only 5 days in a year, in a month, it means like her in quantity the menstruation was a lot, but the duration was still the same. And she used to use 5 to 6 feminine napkins a day, which is according to her is more than usual. So why do we use this? It's like 5 to 6 feminine napkins. This is kind of way how to measure the amount of blood she's losing during her menstruation. So this is a way for the so it could be clear for the patient and for the doctor at the same time. And the menstrual content was blood in fluid and in cubes. What does it mean? It means when she had her period was in fluid, also in cubes, which is clotted blood. No abdominal pain and any other discomforts. And the duration of menses were normal. And pay attention, her menstrual bleeding was more than usual in quantity, but the duration is normal. All right, next one. And on August 2018, routine checkup, she did abdominal ultrasound, and it showed increase of fibroids in quantity. The biggest one approximately 5.6 to 4.1 centimeters. Sorry, I forgot to write the unit here, centimeter, and in its size. And why you guys might be asking, how do you know that it's fibroid? Because usually you are the gynecologist doctor, right? Where you set up the patient for ultrasound, and the ultrasound is done by the radiology department, by the ultrasound department. They see it, their medical professionals over there, they see it and they diagnose what is that thing in there. So they assume it's fibroids, so we trust them because they're more experienced in doing ultrasound and in their understanding and in reading ultrasound papers. All right, so here we increased the ultrasound was increased in quantity, and her blood hemoglobin. She also did a blood routine test, and it was 66 gram per liter, which is what? You're right, it means anemia. So what is the lowest level of hemoglobin that should be in a woman? You guys try to guess, and if you guys are thinking that it is 110 the lowest should be. Yes, you're right, that's the lowest amount, with the lowest border of which is considered as normal. And her doctor, that time her doctor advised her to go through the surgery. She said, nah, I'm good. So she refused to go for the surgery because, and what about, her doctor asked about her, what about the anemia? And she said, yes, let's treat that. Her doctor that time advised to go through the surgery because the fibroids, he paid attention that fibroids were increasing in quantity and they were getting larger at the same time. So subsequently, she was repeatedly gone through abdominal ultrasound and it showed increase in size of her fibroids. And you guys might be asking, why, how does she know that she has to go through the abdominal ultrasound? She came to the outpatient department to do the ultrasound because her menstruation was keep increasing and she was fainting and she had anemia. So she had to come, and doctors obviously suspected that she had uterine fibroids, and she had to go through ultrasound to know the exact cause of her anemia. And subsequently they found out that her fibroids were increased in size, and she was still heavily bleeding during menstruation. And on 2nd July 2019, all right, pay attention, before it was August 2018, right, which is after almost 1 year. On 2019, she also again comes to the hospital. Why do you guys think that she came to the hospital? If you guys are thinking, yes, probably she had she had anemia, or she started fainting, and when you have anemia, you start fainting, you have low blood pressure, and this kind of stuff. Of course, she was hospitalized, and she was not hospitalized. She came here by herself because she was feeling ungood. Let's say like that. So an abdominal ultrasound again showed the fibroids have increased in size. The biggest one is 6.6, 6.0, and 5.5 centimeters in size. And if you guys compare with the previous one, you can see here this is 5.6 to 4.1, right? And here is a 6.6, 6.0, and 5.5, which shows you the increase in her in the size of fibroids, the biggest one. And her hemoglobin is 82 gram per liter. And why? Because she treated her anemia before. That's why it's a little bit more, but still lower than normal. She has to be treated. That time she also took TCT test. If you guys know, TCT test is a thin prep cytology test, which shows us if there's any abnormality in her cervix, and the cytological the cytology showed negative, and HPV also was negative for all possible HPVs she could have got from somebody else. All right, so if you guys are not very clear about TCT and HPV, I might make any other video about this. I don't know if I should make. If you guys write down in the comment if I should. Yeah, so far, I hope you guys are clear with everything I talked about until now, and I hope we are on the same page right now. So her abdominal ultrasound, she did the abdominal ultrasound, right? And luckily I managed to get her ultrasound and took a picture of it, so let's check it out together. All right, so here we have the ultrasound. I'll give you guys some time to take a look. What does it look like? You guys try to determine by yourself where the uterus located, where the uterine fibroid located. For me it's pretty obvious, and yeah, you guys take a look first a little bit. All right, so let me tell you now. And so here, if you guys can see, first let's find out the uterus. Here's the uterus, right? So uterus, you can see here's the upper border, the fundus, the body, and the neck. And here we can see the endometrium. uterine endometrium. Here's on this line, and here you guys might be asking, what is this black thing? Okay, you guys might already know this is uterine fibroid. If you guys paid attention, it's like bizarre, right? It's not the same signal. Like, look here, the uterus is like perfectly same signal, right? It's like same signal all over the uterus, but here the signal is like less, more signal here, less signal here. So what does it say? It means like a lot of uterine fibroids. There were a lot of uterine fibroids, and they increase in size, and then they together formed one big fibroid in here, the big tumor. And also here there's another part of it. So this is if you guys pay attention, the fibroid, and here this colorful things, they show the blood vessels, the blood supply to the tumor. And you guys can also need to pay attention that the tumor is located to the, look, endometrial line is here, right? So it's located very close to the endometrium. It has very significant impact on our surgery, on our way of doing the surgery. So yeah, let's move on. So what are we gonna do next? We have to admit the patient. We have to admit the patient because why? She is bleeding heavily, she's anemic, and we have to do something with it. And we ask her, and she agrees for the admission. It's not like the patient comes up to you and then you are like, hey, hell yeah, we're gonna admit you. No, you of course you're gonna need their permission. And finally she agreed to get admitted. And after we admit, what are we gonna do? We do the physical examination, which showed no abnormality, and her because it's gynecology department, we have to do pelvic examination. And in her pelvic examination, uterus is enlarged like pregnancy of 12 weeks. Pay attention to this one because this is also going to play a big role in our treatment, in our further treatment. So 12 weeks, the size of the fibroid looks like a pregnancy of 12 weeks. All right, so what do we do next? There's a patient. She's anemic, bleeding excessively, and she has a huge fibroid which is equal to 12-week pregnancy. And what are we gonna do next? We have to go to the guidelines. So the next step is here's the uterine fibroids. Why, as I told you guys before, uterine fibroid was already confirmed by the ultrasound technician. So it is a uterine fibroid. You guys can see she's obviously symptomatic. Is she premenopause or postmenopause? As we guys remember, she's 34 years old, so she's premenopause. And there are three things we have to consider. This is very important. You need to ask the patient, does she want to preserve fertility? Does she want to get pregnant in the future? Or she just wants to preserve the uterus, but she doesn't want to get pregnant, or she wants neither pregnancy nor the uterus. Our treatment is going to depend on her answer. So in our case, this patient said that she wants to get pregnant in the future. And what are we gonna do? So here's the medical therapy and the surgical therapy. We have two therapies. Medical therapy, you guys can see it's non-steroidal anti-inflammatory drugs, oral contraceptives, like this much medical therapy treatments. But we chose surgical therapy. Why? Because she had an indication for the surgical therapy. First of all, her uterine fibroids were too big, and they were causing too much trouble, and it was increasing in size pretty quickly. So, and she was heavily anemic, so you have to do something quickly. And as you know, medical therapy, the effect is pretty slow. So, and also, what else indicates for the surgery? Here we have to look at the indication. The size of the fibroid has to be greater than 10 weeks. If you guys remember, the size of the fibroid was 12 weeks gestational size, and she had menorrhagia, which is excessive bleeding, and which led to anemia. Do you guys remember? It was 82. Her hemoglobin was 82 when she was checked the last time. She had the pressure symptoms, but it was mild, but she still had it. And you guys remember, it was growing pretty rapidly. So we don't wait for and here it says failure of medical treatment. We don't do any medical treatment. We directly put her on the surgery, because as the experience says, when there's a patient with a pretty bad symptoms in a heavy condition, what are we gonna do? We try to help the patient as quick as possible. So yeah, of course you advise to the patient, do you want the medical therapy, or you want the surgery? And also, of course, her answer also depends on our further treatment. So she agreed for the surgery, and doctors also think that we also think that she's better to go through the surgery, and we do the surgery. The name of the surgery is myomectomy, which is cutting off the uterine fibroid. All right, but let me guys tell you, it's not actually myomectomy. It is cutting off the fibroid, but how do you cut it off? We actually don't entirely cut it off like this, because it's gonna leave a big scar. It's gonna impact her uterus very dramatically, and there'll be very small space, and she will not be able to get pregnant in the future. That's why we have to act very carefully. And what we're gonna do in surgery here, I don't know if you guys interested, but let me say it quickly. We have to make a small incision hole here, and we have to clear out everything from inside, trying to do less damage as possible, and trying to take the more content as possible out of inside. So we try not to disturb the endometrium, and we try not to disturb the uterine cavity. So we kind of make the small incision, and they try to take all the contents out. But again, this surgery is very dangerous in terms of when she gets pregnant, there's a really good chance that the uterus might tear up, and the baby, the fetus inside the abdomen actually might flow into the peritoneum, which is very critical condition. So of course we have to sign her up for the agreement to this kind of treatment, and that we have to make her sign that she understands all the risks and stuff. All right, so where we ended, surgery. Okay, we're gonna do surgery, right? And I hope you guys are clear how is the surgery gonna go. All right, next one. What are we gonna do? Okay, we don't just put her on to the surgery, right? We don't say, hey, surgery room, please prepare the stuff. We are bringing the patient. No, we have to do some checkups. What checkups do you do? We have to prepare her for the surgery. For the surgery, we have to do complete blood count, to know her white blood cell, red blood cell, and all the cell conditions. We have to. These are all important that have to be done. Coagulative factor test. You guys have to know whether her coagulation factors are all normal, because if it starts bleeding during the surgery, it's a good chance that she might not end up well. So this is also important. Biochemistry, like sodium, potassium, magnesium, all the biochemistry are all important. We have to do ECG. As you guys know, electrocardiography. It's important to check out the heart. We have to do X-ray if her lungs have any problem, and you have to know the liver and kidney function tests. And these are all important before any surgery. Before any surgery, you have to know all these all tests have to be normal in order to go through the surgery. Otherwise, the surgery cannot be done. And tests for infectious diseases. As you guys can know that famous infectious disease like HIV or HCV or something like that, we have to test for them. This is for the doctor's own personal protection, and of course we have to know the blood type. You guys guess it out. Why do we have to know the blood type of the patient? I'll give you, I guess, 5 seconds. Think about it. Why do you need the blood type? All right, so if you think that we need the blood type for, we need the blood type because if something happens during the surgery, if she all of a sudden lose a lot of blood during the surgery, we have to be prepared that we can transfuse a lot of extra blood to her in order to keep her alive. I hope I could explain it pretty well. So you have to keep the blood ready for her. According to her blood type, you have to prepare the blood type for her so you could transfuse in case of emergency. That's I hope I made it clear. All right, let's say she did the surgery, and the surgery went well. And what are we gonna do after the surgery? What are we gonna do is we have to follow up. Is it like she can go for the pregnancy? No, she has to wait for 1 year at least. And first she has to go through the follow-up in the first month. She has to come back to the hospital on the 3rd month, and she has to come back on the 6th month, and on 12 months she has to come back 4 times to the hospital to be tested of her condition. So if she has been follow up every 1 year. 1 year passed, and all follow-up examinations are all normal. You think, okay, so all the follow-up examinations, all of the follow-up tests were all normal. What is the next step? The next step is, congratulations, you can get pregnant now. So I found this funny picture here. I am so ready to have this baby. So her final goal was to be able to get pregnant in the future, and we tried to help her as much as possible. And yeah, that's it for today. I hope I could help you out. I hope I hope you guys learned something, I guess, at least. If you guys liked it, please share, like, and subscribe, which is very important for me. If you want any more videos in the future, if you want any suggestions, please feel free to write down on the comments down below. Other than that, that's all for today. Thank you. Peace out.